Hello, let us now study the skull from above. When you study the skull from above, it is called as Norma Verticalis. So, in the Norma Verticalis, if you see the shape, it is somewhat ovoid in shape, and the bones which we see in the Norma Verticalis are this one is unpaired frontal bone, these are the two paired parietal bones, and some portion of squamous part of this occipital bone can also be seen. Okay. Now, let us know the important things in the Norma Verticalis are the highest point of the skull, whichever region is you feel is higher, that we call it as vertex, and the arched roof of the skull we call it as the vault of the skull. Coming to the sutures, if you see this one, this is what suture lying in the coronal plane, so it has to be named as coronal suture. Similarly, this one is sagittal suture lying in the sagittal plane. So, the coronal suture separates the frontal bone from two parietal bones, and the sagittal suture separates the two parietal bones. This sagittal suture is a serrate type of joint, that means the ends of these two bones, the margin present a sawtoothed appearance, hence we call it as the serrate type of the sutural joint. Although you are not seeing any suture in the frontal bone, but sometimes you can find a suture existing, particularly in children, in the mid of this frontal bone, which we call it as metopic suture, and the meeting point of this coronal suture and sagittal suture is called as Bregma. And the site of the membranous gap in the Bregma we call it as anterior fontanelle. The meeting point is called Bregma and the site of the membranous gap is called as anterior fontanelle. This Bregma usually closes by 1.5 years usually, and it is called fontanelle because in older times when this region was pricked, the blood has oozed like a fountain from the underlying superior sagittal sinus. Since it is resembling, the oozing of the blood resembles a fountain, hence it is named as fontanelle. The importance of this Bregma or anterior fontanelle is when this is depressed, it indicates dehydration or starvation or malnutrition. When it is elevated, it indicates an intracranial rise. It can be in the form of a tumor. Rarely, when required, intravenous administration of drugs can be done through this into the superior sagittal sinus. Intravenous drawing of the blood can be taken, and even ultrasonography of the brain can be performed. Now, coming to this sagittal suture, just you can see this is a parietal foramen, it should be present on both the sides. These are the parietal foramens which usually transmit an emissary vein which connects the superficial veins of the scalp into the superior sagittal sinus with the superior sagittal sinus, and the region between the two parietal foramens we call it as obelion, These two are the parietal eminence or the parietal tuberosities. The transverse diameter of the skull can be measured between the distance between the two parietal tuberosities or the parietal eminence, and which are more prominent in males. And this one is the sagittal suture meeting with the lambdoid suture. This is called as lambda, and the site of membranous gap within the lambda is called posterior fontanelle, which usually closes by 6 months. Is it clear? Then when seen from above, we can see faint lines here which are the superior and inferior temporal lines, They become more specific when we read the Norma lateralis, but here in this view, the superior and inferior temporal lines can be seen from the sides. The superior temporal line giving attachment to the temporal fascia and the inferior temporal line giving attachment to the temporalis muscle. So, this is all about the studying of the skull from above, and that is the Norma verticalis. Thank you.